not stop, and that I don't know whether the organizers did anything. So I'm saying this because this interaction today is a much more profound meeting, and a lot of things that are extremely beneficial that have come out of it. And first and foremost, I would like to congratulate the LOC for bringing up this very, very important meeting and for choosing the very erudite professionals, both the students and the teachers who have performed extremely well in discussing issues that are extremely important for us as doctors. Now I'm saying this, first and foremost, this class consists of maybe 100 and 150, I don't know. So how do the other students learn from what has happened today? Is there a mechanism? Because the two lectures are directly impacting on them, and I think they're extremely important. So how do we get to involve them to be able to learn from this session? So this is just a session like that. But, okay, whatever. What I'm trying to say is this is not just a BUMSA week, something you're doing, but it should be able to have more multiplier effect than for only those who have come. So I think it's extremely important for you to organize so that I think it's more than 75% of you are not here, isn't it? So how do this 75% learn from what has happened, which I think is extremely important. So, as I've said, we have talked about very important issues. The gentleman who talked on Professor Isa's slides, what is his name, has gone. This is the real life situation now, unfortunately, the issue of conflicts in the medical profession. We feel extremely embarrassed that this thing should not happen at all. Or if they must happen, they must happen only at the level of the teams. But the more important thing, which has not been mentioned today, that it is now happening at the level of the professions. It's not just a team in O&G or medicine or surgery that is having this conflict. Now you're having conflict between the professions. And this is very, very unhealthy and unfortunate. But the bottom line for medical students is that unfortunately this is something we must live with maybe for some time before something happens to change it. But one important message which I think we should take away from this is that when you have these conflicts between groups, then these are usually groups that by obligation they must work together. Huh? So if you look at us working in the ward with nurses, attendants, and so on and so forth, it's a small team. It's a theater team, it's a team. And in a hospital like this, you have professionals working. Somebody raised a question of who should be the CLD and things like that. This question were never asked before. Why are they being asked now? There is a lot of envy which is inherent in human beings. But this envy should be managed in such a way that it provides self-respect for whoever it is. But now things are totally in the open now. This didn't quite start now. When I came back from States in 1986 here as a consultant, there's a school of nursing. Somebody, this comrade thing, I said, I'm going to ask you, what does this comrade mean? Anyway, he said he's a comrade, he's teaching nursing students. He says your first enemy is the doctor. This is information. So in other words, this professional envy has been there. Now how do you contain it? Somebody referred to a team, very, very important. So if you have a team is necessary because each of the individuals in the team cannot execute the total goals of the team, him or her alone. So the team is there. You work as a doctor, you need a nurse. Look at the patient for 1 hour, she looks after the patient for 24 hours, and so on. So it's good and it's obligatory to have the team. But there is no team that works without a leader. Now, the leader should be the one who understands most about the objective of the team. And as professionals, we work around patients. We may do research, we may do teaching, but the central issue is patient care. And there is no confusion whatsoever, wherever in the world, who is the center in managing patients. It's the doctor, and there's no problems. But why are we having this in Nigeria? The people are raising this and raising this. They don't do that in America. Everybody has clear direction. It's a part of a system. Everybody has his responsibilities, and he should keep to that responsibilities. That should be provided by the leadership of the hospital or the nation. This is one area we do not have at all. Unfortunately, it's a total mess at the level of government or Ministry of Health. Because if people know what they are supposed to do, very, very clear-cut, all these issues will not arise. So there is a big problem with government, with leadership at that level, because they have overseen this thing. Okay? This will continue to correct whether it will work or not is a simple thing. But at the level of us working together, there is no doubt that the doctor is the head of the team. However, if you are the head of the team, depending on your style of leadership, you may have revolts in that team. And I think this is the central point I want to emphasize today, that while by constitution and by whatever we should be the heads of the team, we have primary responsibilities to own up this headship and leadership by having the correct attitudes and disposition to be able to, supposing now something happens to a patient, the nurse is lackadaisical, and then pharmacy has not worked, lab has not worked, everybody has not worked. Ultimately, it is you that admitted the patient, you that will take responsibility. And if you cannot stay here 24 hours to look after your patient, to execute the instructions you have set at the ward round, and somebody is there to do it, then you have responsibility to ensure that this, whoever it is, has been given the right environment to be able to understand he or she is part of this team and you work together. So I'm saying the responsibility is squarely on us to understand and to play the role that we should play. Of course, you may need support here and there, but if we disregard this, there is no amount of law, there is no amount of precedent that will make the teams work. So we are today talking about ethics, empathy, management, and XYZ, but I want us to continue to look at this important concept. It is embarrassing that you as medical students are being brought to understand this because of what is happening when you qualify, but all the same, I think the bottom line goes back to us. Do we show empathy? Do we carry people along? Because if everybody feels he's part of a team and his welfare is taken care of, he has no option but to defer to the leader of the team. So I want to re-emphasize this to us. Even if there are issues elsewhere, we are also contributing to the issues. And we must make sure that we go above board and do what is expected of us, so that if despite showing appropriate leadership there is problem, then we know where to point out. This is an extremely important problem, unfortunately. It has now gone beyond fighting within the team. It is now a national issue. All this, and it's very embarrassing. Huh? A committee, presidential committee, was set up with the previous government. They went all over the world and came back and wrote, this is what's happening all over the world. And yet this is not implemented. So the central leadership is not working. So So there are problems, but you as the custodians of the profession must ensure that you have maintained what it takes to maintain the integrity and the respect of the profession from your own point of view. And sooner or later, things will be sorted out. But if you, as the center of it, makes one mistake, this is what other people want, and they point out, you are disregarding us, you are doing this, you are not doing. So please remember this. And of course, this goes beyond you. All the doctors, everybody. Now, this set of lectures we have had, talking about conflict resolution, and then methods of learning, essentially, this is what we have discussed. And under it, we have discussed extensively about attitude to our patients, beyond cognitive knowledge, beyond the skills I referred to earlier on. Now, Dr. Zainab repeatedly said we needed a structure to be able to put these ideas into practice. Now, this is the point I'm going to this lecture. How does it get to college? To be able to see whatever is relevant here for discussions at least. It's not going to be easy to change the structures. Many years ago, I chaired a committee here of the college when we were trying to do what we call integrated learning. Now, all the good ideas were there from the teachers. Unfortunately, the students were not involved. So when we did this, they are just waiting at the end. They said, this method is the one that will make them fail. They have what we are simply saying then is, whatever you learn in anatomy, physiology, and so on, ultimately you are going to, the bottom line is the patient, whether it's in ORG, pediatrics, or medicine. How do we ensure that by the time you come to see patient first time, you have been, you have adequate skills from lab, from basic medicine to be able to make an impact. If I give a lecture on enteric fever, typhoid fever, in the pathophysiology of it, have you learned something in the lab? Microbiology, have they done something in the lab? So that by the time the teacher talks, he will be able to tap on all these things so that it's relevant. That was the idea, let's start like this. That was the whole aim. But students, they have their own way of getting information. They said, this is the thing that will make us fail. So we abandoned. What I'm trying to say, this discussion now seems to be mainly student-driven. You want to do pair learning, X, Y, Z. So if you feel it is relevant, it is important, and in other words, you want to push it. The other big problem, of course, will be your teachers. How do they adapt to this method? But the bottom line is, how do we further this along? Not that we change everything. So maybe Dr. Zainab and Halima, since you are in faculty, with the students, if there is a way we could start some discussion at a higher level about our methods of teaching, how can we improve them? It's not going to be a one-day, two-day thing. But the important thing is this discussion, and they let it be carried along further so that it impacts more positively to many other students that are going to come. I'm aware that the system, I'm aware one of the major deficiencies of what we have said is this concept of attitude. Our students come out, they are available, they show empathy, they show respect. We think all this is being eroded. Why was it there? Why is it not here again? Now we agree, and this is all over, it's not in Nigeria, the whole world is complaining. And the bottom line, in some meeting in America said, okay, all this teaching of ethics and so on was through role modeling of the teachers. You didn't spend a lot of time to come and talk to people, but the students saw their teachers demonstrating that and they imbibed it. Unfortunately, that is not so there again. So they said, well, if you cannot force the teachers, why don't you make this curriculum well known now, not a hidden curriculum, teaching. Of course, that will never work completely if the role modeling is not there. So there are two problems. The teachers themselves need to be encouraged to do more role modeling. They must be available in the same local preparation. Some of the things you are saying today, if students see their teachers do this, they automatically will do it. And it goes down like this. Whenever I give lectures to new medical students, they say you have 500 level, you have 600 level. Try and learn, but I give a proviso, learn all the good things you see and then not the bad ones. So in other words, 500 level, 600 level should be role models to 400 level that are coming. So this role modeling is very important. But the bottom line of what I'm saying, the current CC mass of the whole universities, including medicine, what we have said is maybe the teaching of ethics and so on left to community medicine is inadequate. So what we have said is that each and every department should be seen to teach that so that it is reinforced throughout. Now whether this is going to happen or not, I don't know about this CC mass. You know, there is a 20% component of it, they said it should be individualized to the university. So there was a committee under Professor Kulia before she left, and we put two courses. One of them is broadly captured as professionalism. A lot of these things have been put there. So hopefully if this new curriculum is effective, I don't know whether it's going to be effective, there is the whole thing that this structure you are talking about, part of it should come there. So let us try and see how we can push the benefits of this extremely important meeting today and the benefits so that the students themselves are able to benefit, and also it is carried along in our structure so that ultimately it improves learning, so that the performance of our medical students that become doctors become good. I think it's an extremely important meeting. I would like to congratulate the teachers who have participated and the students. I have listened to a lot of confidence in our discussions, which is the sort of thing we want. And maybe this small involvement, because as somebody has said, we continue to interact, continue to talk to people for the rest of their life as long as you are doctors. So I would like to thank you once more for the opportunity to come here, the BUMSA, and everybody who has been here. Thank you so much.